goodness no. So we've already continued with the physical assessment. We're now going to move on to do a cranial nerve assessment. Now, excuse me, we've already established that you are completely alert and oriented. And just so we have it again, go ahead and tell me who you are.
Jane Doe.
Okay. And can you tell me where you're at again?
In the clinic.
Okay, great. So the first thing that we're going to do is check the olfactory nerve, which is our first cranial nerve. And this has to do with the sensation of smell. So what I'm going to do is have you close each nostril. And one at a time, we'll test each nostril. I'm going to kind of wave something underneath, and you tell me what you're smelling, okay?
Okay.
With your eyes closed. So go ahead and close your eyes, and we will check the left nostril first. Okay? And just tell me what you're smelling here.
Rubbing alcohol.
Okay. All right. Go ahead and close your eyes again, and close up the left nostril. Okay? And tell me again what you're smelling.
Rubbing alcohol.
Okay, great. So does that smell the same on both sides?
Mm-hmm.
Okay. Now, good olfactory nerve examination. So we will move on to the optic nerve. Now, we did a more intense exam with the physical examination and did visual acuity. So right now we'll just go ahead and test for pupil response again. And what I want you to do is just take a look right at my nose here, and I'm just going to shine a light into your eyes. So here we go. And we are having good pupil response. Pupils are round, reactive to light, and are appropriately accommodating. Again, take a look at the tip of the pen light here. Look back at the wall. Okay, and again at the pen light. Okay, great. So pupils are 3 millimeters without the light, and they constrict down to about 2 millimeters. So that is normal. The next thing that we're going to test is cranial nerves 3, 4, and 6. And so we're going to be testing different parts of your visual field, okay? So I just want you to look right at my nose here.
Mm-hmm.
And I'm going to be holding my hands up in different areas. And you tell me whether I'm holding up 1 or 2 fingers, okay?
Okay.
Okay. So here we go.
1.
Okay.
2. 1. 1. 2. 1.
Okay, great. So peripheral vision looks okay. Now what I want you to do is just look at my finger here, and with your eyes follow my finger. Do not move your head, okay? So look over here. And we're holding in this lateral position just so that we can see if there's any nystagmus. And do not see any nystagmus. She has good movement with her eyes. And one last test that we want to do here is the cover-uncover test. So what I'm going to have you do is, well, I will cover up one of your eyes, and I just want you to keep looking straight at my nose the whole time, okay? So all you need to do is just keep looking at my nose. Okay. And we're going to do this other side here. And as I'm covering and uncovering her eyes, the opposite eye that I'm testing, I do not see any movement with either of those, so that is good. So the next cranial nerve that we're going to be assessing is the 5th cranial nerve, which is the trigeminal nerve. And what I'm going to have you do is clench your teeth really tight, okay? And just going to assess here, okay? And now what I'm going to do is do some sensory assessment. Now, can you tell the difference here between the ends?
Mm-hmm.
Okay, so I've got a sharp end and a dull end. You tell me where I'm going to be placing on your face. You tell me if it's sharp or dull, okay? And I want you to close your eyes. Okay, and tell me if this is sharp or dull.
Sharp.
Okay, and here.
Sharp.
And here.
Dull.
Okay. Here.
Sharp. Dull. Dull.
Okay, good job. You have good sensory within the face. So the next cranial nerve that we're going to be looking at is the 7th cranial nerve. And so here is the facial nerve that I'm going to have you make a couple different facial expressions for me, okay? First thing I want you to do is go ahead and let me see those teeth again. bright smile, okay? And now puff your cheeks out like a chipmunk, okay? And now give me a big surprise look, okay? And scrunch your eyebrows down. All right, good job. The next thing that we're going to do is assess the auditory nerve, which has to do with hearing. And I've got a couple different tests that we're going to be doing. The first one is going to be the Weber test, and I've got a tuning fork here, and I'm going to be placing it on top of your head, and you just let me know if you can hear it, if it sounds the same on both sides, and then tell me when you no longer hear it, okay?
Okay.
So I'll have you turn forward a little bit here. Can you hear that?
Not very much.
But you can hear
A little
it?
bit. Mm-hmm.
Okay. Does it sound the same on both sides?
Yeah. And I can't hear it anymore.
Can no longer hear it. Okay. Good job. So the next test, I'm going to be placing it in behind the ear, and I want you to tell me when you no longer hear it, okay?
Okay.
And you'll feel a little bit of a vibration there as well.
Now.
Okay. And tell me when you no longer hear it.
Now.
Okay, good. So with the left ear, when we had it up next to the ear, actually touching the back of your ear, the time was about 10 seconds. And so then when we moved it away, it took you about 4 to 5 seconds before you were no longer able to hear it when it was close to the ear canal. So that is normal. Okay, and this side.
Now. Now.
Okay, and same thing with this side. So when we had it up next to your ear, actually touching the time frame that you could no longer hear it was a little bit longer on this side, so it was about 11 or 12 seconds. And then once I moved it to closer to your ear canal, then it was about 5 seconds. So again, still within the normal time frames for that. The next thing that we're going to do is check for cranial nerves 9 and 10, which is the glossopharyngeal and the vagus nerve. And what I want you to do is just open up. Let me find the pin line here. Okay. So stick out your tongue, open up, and say ah. Alright, so from here we're going to also check your gag reflex, okay? Okay? Good. Sorry about that. It's a little uncomfortable.
It's okay.
Alright, so good gag reflex on the left side. Let's go ahead and open back up. Say ah again. Okay, and let's check it on the right side. Alright, good job. Now, I want you to take a drink of water for me.
Okay.
And swallow it, so we can just assess how well we're swallowing. Good job. Now we're going to assess cranial nerve 11, which is the spinal accessory nerve. And what I want you to do is turn your head to the left for me. And now I'm going to place my hand on your face here, and I want you to push against my hand with your face and neck. There we go. Good movement. And again on the other side, okay? And push against my hand. There we go. Good strength. And it's equal on both sides. Now, I'll kind of move you this way a little bit. What I want you to do is go ahead and shrug your shoulders up. Okay, and relax them. And now I'm going to place my hands here, and I'm going to put a little bit of pressure there, but I want you to still try to shrug against my shoulder, or against my hands, okay? Alright, good strength there. Now, the last cranial nerve that we're going to be assessing is the hypoglossal, which takes a look at your tongue. Go ahead and stick your tongue out for me again, okay? Good. Looks like we have good even symmetry throughout the tongue. Move it around a little bit for me, up, down, side to side. Okay, looks great. And now I want you to take your tongue and push it against your cheek on the right side here. push against my finger. There we go. And again on this side. Good. We've got good even strength for that tongue as well. So this concludes the cranial nerve assessment, and thank you very much.